Hi, everybody. I'm Jocelyn Momenta. Who hasn't had a headache? But for many of us, it comes with relentless, pounding pain. Joining us is Hartford Healthcare's Dr. Valeriya Klats, a headache neurologist with the Headache Center in Stanford. It's great to have you with us, Dr. Klats.
Great to be here. Thanks for having me.
Well, when should somebody see a headache doctor?
I think the threshold for seeing a headache specialist should be very low. What we see oftentimes is people delay and wait for some kind of very severe event or very frequent pain, but it really shouldn't be that way. I truly believe that whether you have one very severe attack of a headache per year or multiple mild ones per week or per month, you should see a headache specialist because there's no reason to suffer, not even for a day.
I don't think a lot of people think that way. That's great advice. What can they expect when they see a headache specialist?
So our visits are really quite long, especially our initial visits when we get to know the patient to make the right diagnosis. You can really expect a lot of detailed questions. My patients are usually pretty surprised by the time we get to the end of our interview that we got into such great detail. The reason we do this is multiple reasons. Firstly, we need to make the right diagnosis, and neurologists typically, they take very detailed histories. Then we want to get to know the person. So their medical comorbidities are a big factor in how we then make a treatment plan for you, as well as getting to know the person as a whole, because people have different preferences in terms of how they want their treatment to proceed. Some people like to be very aggressive, just give me everything you have, and some people say, oh, I don't want to take medications, I want to try everything else first. So every patient has a very personalized plan, so our visits are really quite long.
So, what are some questions that patients may be surprised that you'll be asking?
So we follow a headache diary, and every provider will pretty much have a little bit of a different diary, and these diaries are even available online through an app now, but we really get into very specifics of where is the pain. Everything neurologic that can be associated with a headache, we go through a myriad of symptoms that can occur during a headache, and patients often don't report things. So they say, oh, nothing else, just the headache. But then once you start asking, all these details start coming out, like dizziness associated with a headache, vision changes associated with a headache, things that people don't even associate to their headaches themselves until it comes up in conversation, as well as a lot of lifestyle questions. How do you eat? How do you drink? How do you sleep? For women, we have a whole subset of questions, hormone related, because that plays into headache as well.
Well, you said earlier that a lot of folks actually delay treatment. So, what do you say to patients who are reluctant to get help?
Well, I don't get a chance to speak to them. This is an audience we don't get to capture. I really think that that's why we try to really intervene with primary care and work with their other providers to tell them, don't hesitate. It doesn't have to be a commitment to treatment. It doesn't have to be a commitment to a certain plan. It can always change, but it's always great to see someone and get all of your options, because what people don't realize is there is a variety of options to treat headache, whether it's pharmacological or non-pharmacological.
Well, I'm hoping that some folks who are watching this will hear that advice. Describe how migraines can take a toll on family, friends, and someone's job.
So migraine is a leader in disability worldwide. Patients, when they have severe pain, it's not a severe migraine attack, I would say. Sometimes it's not the pain, but all of the accompanying symptoms that they have, even when they're not in an attack, that keeps them from functioning at 100%. So some of those things can be trouble thinking during an attack, inability to function in light or in sound. Some people in an office or taking public transportation to work are triggered by smells. And this plays into everything. because migraine is a disease that typically affects young women the most, women of childbearing age, women with young families, women with careers. It impacts every part of their life because when people have an attack, they are in bed in a dark, quiet room. They can't go to work. They can't take care of their kids. And a large percentage of these people take at least one day off of work per year. And this plays into every part of their life.
You just mentioned migraines as a disease.
Yes.
So you do consider it as a disease. I never heard that before.
And yes, it's definitely true, and it's part of our job to educate people on headache disorders. People think, oh, it's just a headache. It will go away. It will get better. For some people, it will, and those are the lucky ones. But for people who have a disorder such as a migraine condition, we consider it a neurologic disorder. And why is that? Because if it's untreated and unaddressed, we see time and time again that it progresses into more chronic, more daily, more disabling pain.
Well, can you talk about the term medication overuse headache and who is impacted by that?
So medication overuse headache is something that I discuss with almost every single patient, whether they are already in medication overuse headache or I'm counseling them on this term so that they don't enter into that pattern. We typically say that people who overuse medication are people who treat their pain with short-acting pain medicines at least 2 or 3 times a week. And these are people that, they have to do this because they have pain and they need to treat it, they need to address it. So they're reaching for Tylenol or they're reaching for ibuprofen or they're even reaching for a migraine-specific medication that was prescribed by a provider. And what happens is when you enter that pattern of taking short-acting medicines so frequently, more than 2 or 3 times per week, you end up developing a secondary headache condition, is what we call, and we call that medication overuse headache. One kind of other way to describe it is a rebound pain, where your body gets used to a certain level of short-acting medicine, and then as soon as it wears off, the headache bounces back stronger.
I know that happens to my husband a lot, and I've actually told him he needs to limit the use of those types of medications. Now, what kind of medications are available for rescue treatment of a headache or migraine attack?
So, great variety available now. It's been a very exciting time in headache medicine in the past few years. In the past year alone, we have 3 new migraine-specific medications that have hit the market that are FDA approved. And that's been very exciting for a lot of people. Generally, when we discuss rescue medication, we first focus on what has the person tried before or what has not been tried before. So someone who really has not tried too many things before, we do use over-the-counter medications because they are effective, such as ibuprofen, and we're not, as long as it's safe for the patient, we're not scared to go up on the doses as tolerated. But then once that's been tried and doesn't work or been tried too much or there are reasons not to use it, there are migraine-specific medications. The biggest class that's been around for a long time that people may have heard is a class of medications called triptans. And then there's a subset of people who either are not allowed to take those medicines because they have cardiovascular risk factors, or they have taken them and they have side effects, or if they've taken them and they don't work. We're now so excited to try these new classes of medications that end in either gepants and ditans. It's a brand new mechanism of action, and it's been very exciting for patients to try those.
A lot of people are also being treated with Botox.
Yeah, so Botox is approved for chronic migraine only, and chronic migraine means you have more than 15 days out of the month of head pain. So it's really not for everybody, but it is effective with really very low risk because the medicine is not systemic, meaning it's not affecting all the body organs, but just acts locally into where we inject around the face and head. and people have more than 50% of improvement in their headache burden after starting Botox treatment. So that's been around for decades at this point, and is very, very effective for patients.
Are there preventative medications?
Yes, yes. Multiple different types. So preventative medicine, one way to think about that when I describe it to people is we want you to have a steady level of medication. No matter how that medication is, whether it's Botox that's injected or another form of injection or tablet you take every day, we want there to be a steady level of protection to protect people from getting headaches in the first place. And who do we discuss preventive with, who's a good candidate for preventive medicine, is someone who has more than 5 headache days out of the month. I think we need to start talking about it depending on how severe those attacks are. And if you're closer to 10 headache days out of the month, you should most definitely be on it to avoid the medication overuse headache we talked about before. In the past, we really applied other medication classes. They were not designed for migraine. They were designed for other medical issues such as depression or epilepsy or blood pressure and heart rate control. And we found that these medications, through one mechanism or another in the body, are very effective at reducing migraine days and even tension-type headache days. And also in the past few years, there's been new medications to hit the market, first time ever, migraine-specific preventive medications. And that's also been very exciting for patients to try.
There are new treatments for migraine. What are you offering at the Headache Center?
We offer really anything that is available to treat headaches, whether it's oral medications or Botox injections. We talk to patients about non-pharmacologic medications, maybe not everything we offer here in the office, but then we connect them to the right professionals. So some headache disorders require physical therapy and integrative medicine for that. And some people benefit from acupuncture. Some people benefit from biofeedback techniques, which is it plugs them in with a certain specialist in biofeedback. It really tunes them into their own body and is a way to control pain. We treat patients with non-pharmacologic oral medication, which is more natural. There are options such as certain vitamins are very effective at preventing migraines and other types of headaches. So we really work with patients in an integrative and multi-specialty approach, and every plan is very specialized to the patient. It's really, really personalized for them.
Oh, that's great. Do you have some wearable devices that are relatively new that?
Yes.
And do they work?
Yes. So this is a very interesting conversation with patients. There are medical devices that are FDA approved for headaches, and they really vary. They vary. Some medical devices only treat attacks when you have them. So it's something that you use as needed. And some devices you apply every day regularly to prevent a headache attack. Some people just with these devices do well, and some people use these devices in combination with other therapies. And there's no way to predict how one person will respond to the treatment compared to another. So it is something that we offer people, and if they're willing to try it, the companies work with the patients to see how they respond to it.
Is it covered by insurance?
And that becomes a limiting factor with medical devices, because at this time I'm not aware of them being covered by insurance, really any of them. But the companies do sometimes work with a patient, like if it doesn't work, there's an opportunity to send it back to the company, or there are sometimes coupons and promotional discounts, and that's a great time to maybe use that opportunity to try a device.
We talk about some of the medications, but are there lifestyle changes that could make a difference?
Yes. And some people come to us and they already know their bodies, and they say, if I don't drink enough water, it will trigger a headache. If I don't get enough sleep, it will trigger a headache. And one of the things that we do is we work with patients to understand their triggers and understand their environment and how that plays into their headache care and their headache burden. So improving sleep and healthy sleep hygiene, adequate water, certain foods can be triggers. If food is a trigger for you, we really counsel people that certain foods are more likely to trigger a headache, certain alcohols. So yes, that can definitely play into it and can be an area of great improvement right there.
You really take a holistic approach to patients.
Yes, it's a whole body approach.
Thank you, Dr. Klats. We appreciate your advice and as well as just the information you've shared with us today.
Of course, my pleasure.
To learn more about the Headache Center and Dr. Klats, head to hhcheadachecenter.org. I'm Jocelyn Momenta. Thanks for watching.
Thank you.